So our first speaker is Ihai. So Ihai is an occupational safety and wellness consultant, and he has many certificates, like numerous certificates around global health and community public health. So Ihai is an MBA, Masters of Business Administration, and also a Masters of Science in Workplace Health and Safety, and is currently a doctoral fellow doing a study on workplace health and wellness promotion. Ihai is a certified life coach, mental health ambassador, and West African regional ambassador to Patient Safety Movement Foundation. He's also the Chief Executive Officer of Occupational Health and Safety Managers, the head of OSHversity, and president of OSH Africa. And as I said, we're working on a memorandum of agreement collaboration so we can sort of formalize our communication and relationship with OSH Africa. He's a member of Board of Trustees in Occupational Safety and Health Africa Foundation, OSH Africa, and Occupational Health Research and Development Initiative. And I'm really grateful to Ihai for being such a great member with Workplace Health Without Borders, and also, helping promote our cause, which are in line with his as well. So we have that, we share that passion. And so now I'll just pass you over to Ihai, who's going to be talking about schools opening in Africa in the time of the pandemic. Over to you, Ihai. Thank you.
Okay. Thank you so much, Kevin, for such a very brilliant introduction that has put me under pressure. Okay, you can see my screen, am I right?
Yes, we can.
Okay, I'll be sharing within the minutes I have at my disposal the work we have done in trying to reopen schools in Nigeria and trying to see how many people we can train and to get this up and running. But before then, I want to first look at the prevalence of COVID-19 in Nigeria. As at this moment, we have 51,000 confirmed cases in Nigeria, and over 1,000 deaths have been recorded thus far. That's for that. What has been done in Nigeria, there is both national and state approach to COVID-19 response. The Nigeria CDC has been able to come up with a document or a guideline called Guidelines for Learning and School Facilities Reopening, and which of course you can find in this link I shared. And that document is already there that guides all school owners and school managers on what is needed to reopen schools. And it is important that every state in the country is taking a leap from this and trying to have this document domesticated into the level of prevalence within their state and coming up with a document that the state can call their own and own for COVID-19 response. But we've been fortunate because we've had the opportunity to test run COVID-19 response in school reopening, because final year students in Nigeria have to go back to school to write their final exams. So that has been an opportunity we've had to test run people coming back to do that. That was done in clusters of senior students coming to school. At least the lesson learned from them is being built on to ensure that others who are coming to school are able to come to school, and building on what we've learned from the test run during the examination of the senior school students. Well, these are some of the principles that is available in the NCDC document for school reopening. And one of such critical things that there must be a very wide consultation, between all the key stakeholders in school before documents or processes for school resumption are put in place. And there must be transparency and scientific evidence in all that we're doing in ensuring that that happens. Then responsibility also has to come in, within the school authority and stakeholders and owners, and being able to make provision for all categories of people, mostly the disabled, the physically challenged students who are in school. You will agree with me that the introduction of nose mask will make it difficult for children who have to learn through reading the lips of teachers to actually be comfortable in school. That's a very clear area that is coming up in the training we are doing. Those who read lips as students to learn, how are they going to learn within this time that we are in? So that has become a challenge. We're currently dealing with trying to see how we can get a better policy that can actually, a policy that can cover those set of people appropriately. Now, within the NCDC guidelines, staying at home and learning safely is also an option that has been brought up. It means we must all not come to school. If we have an opportunity to make our students stay at home without coming to school and they're still able to learn, that is very important. Then safe distancing will be a very key issue. Like you saw in the last CDC report, we've been talking of the issue of 6 feet, but in the last CDC report I saw a week or two ago, and what has been alluded to in that report is that if you cannot achieve 6 feet, but you can achieve 3 feet, but make wearing of mask compulsory for everyone, both the teachers and the students in that class, you can also have benefit that is close to what you will have when we achieve 6 feet social distancing. Alternative models have also been included in the NCDC approach. It means you can have models where you can actually learn outdoor through outdoor shelter and all have you. The staggered attendance is also an issue. I mean, how many days a week do you want people to come to school, or how many do you want to come to school at different times? But for the senior students, alternate attendance per week has been recommended. What that means is that for the senior students who are independent and able to manage on their own without close supervision, they can come to school maybe about twice a week. But the schools are allowed to decide what works for them and what they think they fit into. So it's a very flexible system that we've had in place in Nigeria. Then decreased interaction by learning in clusters and cohorts. What this also means is that when students come to school, there is no need for them to mingle, isolate all the students to their classes until they're about to leave. Even the meals will be served in their classes instead of allowing them to go to cafeteria to eat together. So with what the NCDC has put in place, this was what we're testing those processes during the final year examinations for students who are in secondary school. These are what we're able to achieve. You can see the classes right now. We have a non-physical distancing. You can see the hand sanitizer in front of a student, and they're all using nose masks. The testing of temperature is already available, and hand washing facilities are available at the school entrance gate for anyone coming to the school, and at strategic places within the school environment. And before reopening, what that guidelines also says that teachers must be well trained, must be trained on what to do, mostly on the issue of hand hygiene, nose mask, and physical distancing. And when we're doing this training, you're not going to have a blanket training which speaks generally to everyone. You have to segment everyone into different groups and speak to their peculiarity within the school. And that was the approach we used while we're doing our training lately. And what we did was to see how we can have people come into their different group, cleaners come together, drivers come together to speak to their specific needs. There must also be a system that you can put in place. Should there be referral you need to do, there must be a protocol in that. Creating immediate temporary isolation space. Every school that is open in Nigeria right now, it has become a prerequisite that you must have a temporary isolation space that you must use should you have issues that are suspected to be COVID-19 related issue. But this is most importantly, so far we've trained 724 students, schools employees in different areas. We looked at the security men who are the ones that interface with people as they come into the school. Their training was totally different. And we taught them on the use of non-contact infrared thermometer and the PPEs that is applicable to them while they work at the gate. We look at those at minders who also have their own category, have to look at children who are under 2 years of age, pre-kindergarten children. But most importantly, what has come up in this training is that we realize by science that have revealed that children under 2 years old may not need to wear nose masks as they come to school. But so long as they don't wear nose masks, everyone working with them, who are the handlers, must wear nose masks and have their hands properly washed at all times so that these children can be kept safe. And it's obvious why they may not be allowed to wear those masks in this underage children, because children need more oxygen to survive within this age bracket than adults will ever need. We also have the training that were designed towards the school bus drivers. And one of such training is that the school bus drivers must be barricaded from the children that he carries. And again, the school bus drivers must have his body temperature checked before embarking on every journey. And the school bus driver go with a minder who is in the vehicle that also checks the temperature of every student before the student is allowed to come into the bus. But mind you, any child whose temperature exceeds the permissible limit by the school will not be allowed to board. The minder calls the school authority, who speaks to the child's parents and say that, and I explain to them why these children cannot be in school. We did that. They will also look at teachers. We also had a specific training for teachers at the different categories. We also had training that were designed towards cleaners. And one of the key issues that came up in this training for cleaners is the issue of introduction of new and varied level of chemicals in the school. And one of the things we realized, we were able to realize in this training is that the cleaners have been able to understand the reason why they shouldn't mix different chemicals or different constituents together to do their cleaning. You know, when you mix chemicals together, what you have is chemical reaction, and the fume from those chemicals could be so hazardous to the human health, like mixing bleach and ammonia could even kill. So we've been able to actually demystify risks that surround these areas, and they are good with that. And we also find out that as schools are resuming, we have varied degree of chemicals coming into the school, and how do we store them so that they don't also pose a new dimension of risk to children who might mistake them for water can and take them. These are some of the training we're able to achieve, owing to the fact that, yes, we cannot achieve every training through physical class or virtual class, because there are a lot of people who are semi-illiterate and are not well educated and may not have access to internet or laptop. We have to create physical class for those ones. But what we did was to ensure that adequate spacing was put together to ensure that we also maintain the level of physical distancing that was required. So we have both virtual class and physical class. And what we did was to use an employee-centered approach in our trainings. What that means is that every employee that we trained, we emphasize the need for that employee to go back home and train and speak to educate members of his family, because employee that is trained and has the requisite knowledge and the members of his family have no such education on COVID-19, it is natural that that employee will want to care for his family if they come down on COVID-19. And doing that, we could again introduce COVID-19 into the workplace. So that was done. Like I spoke about this earlier on. Children who rely on the movement of leaves for learning, what are we doing for them? This is a big challenge. We have not been able to work around what we feel will be best in handling children in this category. But in the training that we had, we realized this is a big challenge that we have to deal with. So I mentioned this earlier on the CDC report. Most of the things that used to be done in school before, like singing, we have also put that one on hold, because you cannot do that anymore, because the more you sing, the more you exhale. And when you exhale, you have droplets that come out, and that also put everyone at risk in the school. But we found out that in most schools that we trained, the use of tap that you open up with your hand, and when you finish cleaning and washing, you use the same hand to stop the water from running. And we felt that was not a good approach. So what we're doing, we're recommending the tabs that uses sensor, and the tab that you can operate through your elbow tabs, the tabs that we use in theater for school, so that we don't clean our hand and end up reinfecting our hands and live without false impression that we've done our disinfection or sanitize our hands. So I just run through this. I've talked about this earlier on, the chemical constituent and the mixture. And again, in this training, we also emphasize the need that bleach solution like sodium hypochlorite, when we have done the dilution, it should not be kept after 24 hours, because it loses its potency. So we live with that mixed feeling that is still potent, but the strength of that diluted solution, it dies up after 24 hours. So we've been able to know that we have to mix as little as we can, as we need for our work. They will also emphasize so much on documentation, because what we do not document, it was never done. So this is a key issue, because we don't pray for the worst, but should the worst happen, we need documentation to bail us out of those troubles. So this is just what we also share with them on the dilution of the cleaning agents and the strength at which it should be diluted. Like you have the sodium hypochlorite is diluted on 0.01% strength, and the sodium and the hydrogen peroxide is diluted on 0.5% formula. So we taught them this so that they know how to do this with little or no supervision. But we also had the issue that came up across the training where we saw one of the schools looking at the issue of UV light. And this is a no-no to us because from researches, UV light has high level of carcinogenic substances and should not be found near schools, because when we use that for disinfection in schools, we also expose children to a high level of risk. And again, we also talked about disclosure. If you are not feeling well, must you come to school? No. And these are things we've told all the schools to put in their policy, whether you can call into school to tell school you're not feeling well and stay away from school. I think in a nutshell, these are the things that we did, but we also looked at the issue of nose mask wearing. What is the proper way to wear nose mask? When you wear nose mask and it covers your jaw, is this still a nose mask or is not a jaw mask? So this was also a key issue, and how to monitor compliance, how to use nose masks properly, and these are the things we ran through. So in a nutshell, this is what the training was all about. But we are very happy that every segment within the school, we were able to design slides that speak to their specific needs and how to play safe within the time that we are in. So at this end, as I round up, I want to again salute every healthcare worker who has been at the forefront of the fight against COVID-19. Sacrificially, you've given all that you have. And those that have lost loved ones, we also burn this candle to you, and our heart goes for you. And thank you very much.
Thank you very much, Ihai. It's really fabulous to hear what different sectors, different countries are doing.
My full name is Đường Khánh Vân. You can call me Vân. Yes, my given name. And I'm a public health activist, and I have been working in the National Institute of Occupational and Environmental Health for nearly 27 years. And we focus on psychophysiology of work and school health, environmental health, and sanitation. And currently I'm working as the director of the Center for Training and Scientific Research Management and International Collaboration Center in the Institute. And it's my pleasure to join the meeting today, actually the teleconference today, and to share with you some information about the COVID-19 prevention in schools in Vietnam. And I hope that my information can give you some interesting information about Vietnam, because we're from different country, but in the COVID-19 context, maybe we have to face the same problems, the same issue, and we can learn from each other. Some slides on back to schools in Vietnam in the context of COVID-19. As you know, that the early September is the time for school in Vietnam, and we have to do many things for school reopening in September. I think September the 5th is the opening day for schools in Vietnam. First of all, I want to share with you that the government perspective and strategy on prevention of COVID-19 in Vietnam. Actually, we have some strategies. First of all, is that active prevention. It means that we prevent the disease. We prevent disease entering the country, and we also prevent disease spread in the country. And the second one is that we focus on early screening. We expand the PCR and ELISA testing to confirm the case. We call that the confirmed case, we call the F0. Yes, and all the confirmed case will be sent to the specialized hospitals for treatment. And the next steps that we do with rapid isolation and tracing is that we find out the direct contact to the F0. We call them F1. And for the F1, F1 are the one who have direct contact to the confirmed cases. And for the indirect contacts, we call them F2 and F3. And we have a different strategy for F1, F2, and F3 in Vietnam. After we doing isolation and tracing, we send F1, F2, and F3 to quarantine. And for F1, they must to go to quarantine facilities. Yeah, actually in each province, we have some designated quarantine facilities. But for F2 and F3, it means that in direct contact to the confirmed cases, they must be self-quarantined at home with very close monitoring from the commune health service. And the next one that we focus on extinguishing the outbreak by doing environmental disinfection, isolation and quarantine, and we also applied, in Vietnam we call that social distancing. I think that in the presentation of Dr. Ihai, he said that physical distancing, that we do the same in Vietnam. Yeah, and from very beginning of the outbreak in Vietnam, the government have a very quick action. We established the National Epidemic Steering Committee and headed by the Prime Minister. And at that time, the Vice Minister also served as the Minister for Health in Vietnam. And all the policy, the guidelines, strategy, directives have been confirmed and spread throughout the country very quickly. And in the very, very early, on the very, very first case in Vietnam, I think that in the end of January this year, we also have a special task force established by the Ministry of Health and by the government, sent to the Sơn Lôi. Sơn Lôi is the first entry point of COVID-19 outbreak in Vietnam. And we focus on treatment, on prevention, on isolation areas, and on communication. And all the information updated daily, twice a day. And we also have a website on COVID-19 prevention by Ministry of Health and by the Health Education Media Center. And also in Vietnam, for school children, I will give you a very quick number. In Vietnam, we have around 44,000 educational facilities with more than 23 million school children. This accounts for 1/5 population in Vietnam. And for COVID-19 pandemic in Vietnam, the first confirmed case recorded by the end of January. And up to date, I think that we prepared this presentation in the morning, and I think that up to 6 p.m. today, we have 1,044 confirmed cases. That we have four new cases today, and in which 315 are imported cases. It means that the patient carry out the virus before entering to Vietnam. And we have 694 locally transmitted cases, and unfortunately 33 deaths happened. Yeah, very, very sadly that I have to say that, because Vietnam we hold no death case of quite a long time, but actually for last month we have 33 deaths in Vietnam from the COVID-19, and but luckily up to now no case transmitted in school. Yeah, and here's a quick view of the yeah, you can see here. Just a moment. Here you can see the how to say, the quick view of the COVID-19 cases in Vietnam, and mostly are adult and school children. I mean that the children under 18 is nearly only 7%, And here we, most of the cases are infection in the community, and some children infected before entering to Vietnam, and no cases in transmitted in school, as I said before. And the distribution of the cases by age, I think that equally, I think from 1 to 5, 5 to 6 to 10, and 11 to 15, and more, and from 16 to 18, it is equally in all group. And here in Vietnam, we have some principle for COVID-19 prevention in school. The first principle agreed by the Ministry of Health and Ministry of Education is that educational facilities, teachers, students, school staffs, and parents all should be provided fully information, knowledge, and raise awareness on how to prevent COVID-19. And the second one is that all educational facilities have to prepare well all requirements and conditions for COVID-19 prevention, ensuring that schools are safer than office. Yeah, because children are maybe more, need to be put more attention. And the third one is that every school should have a preparedness and response plan in place to protect teachers, school staff, and children from spread of COVID-19, and to respond and have to quick rapid response plan if they found a student, a teacher, or staff member suspected or positive for COVID-19. And based on those principles, Ministry of Health and Ministry of Education work together, and we developed different guidelines for schools, for teachers, for healthcare officers in schools, and also for children and for parents, and how to protect children from the COVID-19 pandemic, and how to prepare well the school for children when school reopened. And for example, we have a guideline on how to practice personal hygiene, including hand washing with soap and clean water, disinfection hand with some disinfection liquid, or how to wear the face mask properly. And also we give guidelines for schools on how to clean and disinfect environment and surface such as chairs, table, floor, toilet, and school vehicle, if any. And also to provide guidance for school teachers and students, what they need to do before going to school, why on the way to the school, during school time, and after the school time. And here, for example, here you can see the picture that they have to do the school. I mean, the school have to do that, cleaning the classroom before the school time, and they have some people, that's school staff, that they to do the body temperature check, and mask wearing check before the children enter the school. And also the school have to provide some designated place for hand washing. They may practice hand washing with soap and clean water, or with some disinfection liquid. And also they have physical distancing. Here you see that in the kindergarten, in the picture below. Yeah, and we also we also have a very specific requirement. For example, before the school reopening in September, early September, uh, for some big city like in Hanoi, they have a very determined guidelines from the city authority. Is that each school must prepare a quarantine room. Yeah, prepare in case that if any students or staff members or teacher have symptoms of COVID-19 positive, they need to have a quarantine room for them, as they have a very specific requirement for that quarantine room, like they separate toilet inside or good ventilation, no air conditions, etc. And disinfection, waste management, something like that. And very specific. Actually, we have a very long, how to say, long list of what the school, what the teacher, what the staff members, what parents, what children should do before, during, and after school time. And here we, based on the official guidelines from the Ministry of Health and Ministry of Education, we work together to develop some like an infographic or some poster to make the schools, the parents, teacher, and student understand more clearly on what they have to do, and very specific. For example, for this one, they give the guidance on step by step that what teacher should do every day before the school time, that well prepared to receiving students. And for this one, like what schools should do when recognizing a student having symptom, yeah, not confirmed case, but having some symptom like a high fever, coughing, or heavy breathing. What they need to do, the step by steps, and for each poster like this, we have like a hotline, Ministry of Health hotlines and website, and they can contact to the Ministry of Health or the health service easily. And for this one, for example, and what students should do every day in school in order to prevent COVID-19 transmission in school. And we have so many things like that. And we also have a guidance on how to arrange the schools and the class appropriately for teaching and learning. For example, we have a strategy like a staggered learning shift or online teaching and learning, and we keep physical distancing like this. And also like for some activity, we usually, for example, like salute the flag. Usually the school will do it in together, all like maybe 1,000 students together. But in the context of COVID-19, we do the salute the flag inside the class, yeah, and to reduce the contact between the students. And here we organize some physical exercise inside the class with like physical distancing like that. And here in the lunchtime, we keep distance between the students. And we also focus on communication, because we realize that our program will be successful or not mostly depends on the obedience of the students and on the cooperation from the parents. And that's why we organize many different communication channels, like on TV, on radio, and also in school. Yeah, here some healthcare staff can give some guidance for students And here they how to say, give instruction for students how to clean the hand properly. And here we also have some, we call that a creative communication, like we organize some painting competition for students to raise their awareness about the risks of COVID-19 transmission and how to prevent COVID-19 due to open school. And they have to well prepare. And the first one is that 100% of student, teacher, and staff wearing face masks on the way to go to school. And the school have to do the class disinfection, equipment, car, and class disinfection as guided by the Ministry of Health before the school time every day. And during the school time, they have to ensure the physical distancing between students, between teachers, and between students and teachers. And the last one, that they have to clean and disinfect the surface, the floor, the cars, the toilet, and they have to wear the face mask during the school time. And that's all what they have to do to ensure that the school environment is safe for the student to come to learn, and for the safe for the teacher to come to teach. And so far, what we got so far, yeah, as a result of all activities in Vietnam on prevention of COVID-19 in the schools. And you can see this on the slide that actually from the January to April this year, all students in Vietnam stay at home, because at that time the situation is a bit complicated, and they just stay at home and learning online. And after April, students were allowed to go to school when no new cases were found after 14 days. And in this month, I think in August, in Vietnam, we have a very important examination. We called it the National High School Graduation Exam. And it has been successfully organized first phase. And just early this month, that nearly 1 million students have had to take the high school graduation exam successfully. And for the next, I think that next month we have the second phase for around 26,000 students who were currently quarantined in facilities and at home during the first day, because at that time they were in quarantine time. And that's why the Ministry of Education will organize the second examination for them next month. And up to now, not any student affected by COVID-19 in school. Yeah, I think this is the first success in Vietnam. And here just some quick introduction on what we, as a National Institute of Occupational and Environmental Health, what we have to do to contribute on the fight of COVID-19 in Vietnam. Actually, we joined as a National Institute. We joined the fight, COVID-19 fight, very early. I think that right after the Tet holidays. And we also the members of the government special task force to Sơn Lôi, and we developed the guidelines, and we deliver the guidance for the healthcare workers in Sơn Lôi since February this year. And we also joined the team with the Ministry of Health and Ministry of Education on development of different guidelines that I just mentioned before. And we also support the special task force in Sơn Lôi by giving them some disinfection liquid and also some how to say, like some new technology on environment disinfection. And I think that inside the institute, we also organize how do you call that, we also set up consultation room. Yeah, we serve the workers, the communities, also school around the institute area. And we also established a hotline to provide guidance on how to clean and disinfect environment, and how to wear the face mask, and etc. etc. and to support the community, including the school in the surrounding area. And we also provide guidance and consultation for factories and workers, and on how to prevent COVID-19 in the factory and in the dormitory, like this one, the dormitory for workers. We also provide guidance and consultation for school and students at how to clean the surface and how to set up hand washing facilities, something like that. Yeah, and we also develop different type of communication, like how to say, handbook for COVID-19 prevention for factory, and posters and leaflets, and also we have some guidance for foreign workers, because we have some, how to say, some customers like Samsung or Yamaha. I think that's the foreigners, and we support them by providing some guidance in their language. You know, so this one, I think that this one is somewhat familiar with some of you. I hope, yeah, because it's a very we call it creative communication. The Dr. Hai, our director, that work with some artists, and we developed a new, how to say, new lyric for the very famous song in Vietnam. We call that Can Covid. Yeah, I can send you the link. I can see that what we have to do. You actually have a new words for the very famous song. And that at that time, everyone in Vietnam can how to say, can access the information on COVID-19 prevention easily. And at that time, if you go to Vietnam, you can see everywhere on the street, the workers and the students, they sing along the how to say, the clips, like wash, yeah, clean hands to save your life, clean hands to prevention of COVID-19, etc. It's very interesting, and yeah. And yeah, we have some lessons learned from the prevention of COVID-19 in Vietnam. That we think that the first one is that the Vietnamese leadership began with COVID-19 prevention from very early. The very first case in Vietnam, all the political system joined the battle team against COVID-19. And I think that the point of entry, the Sơn Lôi, has been tightly controlled, and all the suspected cases quarantined immediately. And actually, we based on what we learned from Sơn Lôi, so many different guidance have been developed properly and applied very well in the for school, for factories, for office, for community, etc. And the epidemic, I mean, that's the special task force have carried out target testing and aggressive contact tracing. I think that the tracing is very important. By that way, we can find out the direct contact and indirect contact, and can have them quarantine timely. And the public is well informed and very good obedience. I mean, I can say that on the personal protective measures like a hand washing and a face mask wearing, and the public compliance with the precaution measures, including physical social distancing, very well. Yeah, and also for this battle with COVID-19, we have a very good collaboration with private sectors, NGO, and big companies. It can support the government with necessary equipment and solution to against COVID-19. And now I just I would like to to stop my presentation by now, and thank you very much for your listening, and I hope that my presentation will bring to you some useful information. Yeah, thank you very much.